Hello, NephU community, and welcome to today's webinar, where we will be having a panel discussion on hot topics in polycystic kidney disease nutrition. My colleague Molly and I will be your moderators for today's discussion. My name is Dr. Andrea Mohindra. I'm a Nephrology Clinical and Scientific Liaison with Otsuka. I'm a PharmD by training, and I live in New York City. I'll now pass it to Molly to introduce herself and our panel experts.
Thanks, Andrea. My name is Dr. Molly Jansen, and I am also a nephrology clinical and scientific liaison at Otsuka. I have a PhD, so I'm a scientist by training, and I am based out of Texas. I have the honor of introducing our three panel experts for today's webinar. First, we have Dr. Shivam Joshi, who is an internalist, a nephrologist, and plant-based physician practicing at New York City Health and hospitals. He is also a clinical assistant professor at the New York University School of Medicine with research interests in plant-based diets, fad diets, and nephrology. And he has written numerous scientific articles and speaks nationally on these subjects. Our second panelist is Dr. Kalantar-Zadeh. He is a professor of medicine and public health at the University of California School of Medicine. He is triple board certified in internal medicine, nephrology, and pediatrics. He has authored over 1,000 papers and publications and has numerous NIH grants as a PI. Dr. Kalantar's core focus is in nutrition and diet in the management of kidney health and disease, as well as dialysis transition and therapies. Our third panelist is Misty Nason. She is a registered dietitian and nutritionist, and also the founder of her own practice, Viva Nutrition Counseling. She has over 22 years of clinical nutrition experience and has worked with people who have chronic kidney disease for over 20 years, both early stage CKD and requiring dialysis treatment. We are thrilled to have these three panelists with us today, and if you would like to read their full bios, you can see those on the NephU website. Thank you all for being here.
All right, so Spotlight is on nutrition today, and Dr. Kalantar, Dr. Joshi, and I are excited to talk about hot topics in nutrition and PKD and recent research. As we know, dietary intervention is a key part of the care of CKD patients and aims at preventing CKD progression, limiting the negative impact of CKD complications such as cardiovascular disease, bone mineral disorders, or complications derived from the causes of CKD, diabetes, hypertension, obesity, as Dr. Joshi mentioned, while preserving the nutrition status. Studies have shown us that we see fewer hospitalizations with adequate nutrition in CKD, also adequate lean body mass. So we know this is important. So far, nutrition guidelines for PKD generally follow the same guidelines for CKD without specific dietary therapy to address mechanisms involved in cystogenesis, cyst growth, fibrosis, inflammation, and disease progression. However, we're excited to talk about recent evidence has suggested that more tightly specified dietary regimens hold promise to slow disease progression, and the results of ongoing human clinical trials are eagerly awaited. So more nutrition evidence information is on the horizon.
Yes, so this is Cam Kalantar, and I have been listening and enjoying this great introduction. One of the areas I have been involved both in terms of research as well as hands-on patient care is related to what colleagues here mentioned. That means nutrition in kidney disease or kidney nutrition, also known as renal nutrition. So here we thought to highlight the different areas and opportunities we have when we are talking about nutrition in kidney disease. A person who has polycystic kidney disease, mostly these are autosomal dominant PKDs. They always ask anybody from physicians to specialists to dietitians, doctor, dietitian, what should I eat or not eat, right? And this question is inevitable because they want to know how to continue with their life and having polycystic kidney disease. Now, here we have highlighted, I'm starting from the left side, highlighted some of the relevant keywords. So low protein diet has been around for almost a century now. When somebody has kidney disease, including polycystic kidney disease, this has been looked at. There are an overwhelming number of studies about low protein diet and very low protein diet, different types of low protein diets. And we're going to go over this briefly, but the one that has recently become quite interesting is caloric restriction. That means less energy intake. So you may say that if the patient is going to have both low protein and low calorie intake, what remains? So we're going to discuss actually that would be the highlight would be the fat or lipids. Then the area where our colleagues, Dr. Joshi, has really touched on and revolutionized is the plant-based diet. That means more plant, less more animal-based protein, less plant-based protein, and the combination of all these is about has been also been presented and discussed in the form of ketogenic diet. That means a diet that has more fat, less protein, less maybe even carbohydrates, and the ketogenic diets could be plant-based or plant dominant. So these are all compatible. Now, going back about things related to plant-based diet is, I'm going to start now on the right side, the keyword fiber, high fiber intake that has been shown to be favorable cardiovascularly, as well as some data about kidney health. Losing weight, as Dr. Joshi mentioned, the keyword obesity, and then more plant-based diet is related to less acid and more alkali. That means lowering acidogenicity. So this is a nice overview again, and allows us to think what we would be able or should think of to offer to our patients.